Welcome to the lecture on sexual assault. So sexual assault is a broad term that encompasses unwanted sexual advances and sexual harassment, including stranger rape, marital rape, date rape, drug-facilitated sexual assault, incest, human sex trafficking, and female genital mutilation. So sexual assault and sexual violence refers to unwanted sexual advances and sexual harassments, which include stranger rape, marital rape, date rape, drug-facilitated sexual assault, incest, human sex trafficking, female genital mutilation. What is a rape? Rape is a non-consensual activity. Any penetration of the vagina or anus with any object or body part, or the oral penetration by a sex organ of another person is known as rape, and is the second most violent crime as per FBI in 2012. In the United States, 1 in 5 women and 1 in 71 men have been raped at some point in their lives. Women who identify themselves as multiracial are the most likely to be raped, followed by American Indian, Alaskan Native, and Black non-Hispanic. Among half of the female victims have been raped by an acquaintance. Intimate partners accounted for about 45% of female victims. Nearly 60% of women who experience alcohol or drug-facilitated penetration were victims of acquaintances. About 45% of male victims were raped by an acquaintance, and intimate partners raped 29% of male victims. About 15% of women and nearly 6% of men have been victims of stalking at some point in their lifetimes. Moving on to spousal or marital rape or acquaintance or date rape. In spousal rape, the perpetrator is married to the person raped. In acquaintance rape, the perpetrator is known to and presumably trusted by the person raped. It is found that sexual distress is more common among women who have been sexually assaulted by intimates, and fear and anxiety are more common in those assaulted by strangers. Depression occurs in both the groups. Now let's look at acute and long-term phases of rape trauma syndrome and identify some common reactions during each phase, and analyze personal thoughts and feelings regarding rape and its impact on survivors. Looking at acute stress disorder and post-traumatic stress disorder. Acute stress disorder is something that is experienced within 3 days to 1 month duration. The symptoms occur within 3 days and can extend up to 1 month. The symptoms may be characterized by intrusive symptoms, negative thoughts, dissociative symptoms, avoidance, or arousal symptoms. Further, if the symptoms persist beyond 6 months, beyond 1 month duration, it is called post-traumatic stress disorder, and the symptoms might persist for over 6 months. That is known as post-traumatic stress disorder. The symptoms are similar with the two diagnoses. The PTSD may be diagnosed in children less than 6 years of age, school-age children, adolescents, and adults. The patients with PTSD can experience the symptoms such as intrusion symptoms, avoidance symptoms, negative symptoms, arousal symptoms, and also dissociative symptoms such as depersonalization or derealization. What are the psychological effects of sexual assault? The psychological effects of sexual assault can include depression, suicide, anxiety, fear, difficulties with daily functioning, low self-esteem, sexual dysfunction, and somatic complaints. Victims of incest may experience negative self-image, depression, eating disorders, personality disorders, self-destructive behaviors, and substance misuse. Patient can have chemical dependency, compulsive sexual behavior, or psychosis-like symptoms. So what are some specialized sexual assault services that are available? Many facilities have trained sexual assault trained examiners or SANEs. These are RNs with specialized training in caring for sexual assault patients. They demonstrate competency in conducting medical and legal evaluations. They are a member of the Sexual Assault Response Team. A sexual assault response team is a multidisciplinary team which includes nurses, physicians, attorneys, social service workers, advocates, mental health professionals, forensic laboratory personnel, and other collaborative agencies that provide services for sexual assault patients. A SANE has the ability to be an expert witness in the court. So SANE must be prepared to provide both medical and legal aspects of care to the patients. First is assessment. You assess the level of anxiety the patient is going through. Then develop mutual goal setting and use appropriate techniques to lower the patient's anxiety. Provide a safe environment. Identify their past coping skills. Explore their thoughts and feelings. Identify what we can do to help the patient in this difficult situation. Encourage the use of available support system. Involve patients, family, friends. Use other medical providers. Use the team approach. Get available community resources to help the patient. Assess for signs and symptoms of emotional trauma. Look for signs of suicidal ideation. Assess for physical and psychological needs of the patient. Have a non-judgmental approach. Listen to the patient. Allow the patient to talk at a comfortable pace. Look for signs and symptoms of physical trauma. These trauma or signs of trauma are legal evidence. So as a sexual assault nurse examiner, we have to look for signs of injury. Injuries to face, head, neck, extremities, anogenital areas. Physical injuries should be documented. Their size, color, description, location of injury, both in narrative and pictorial form. If an injury is present, ask the patient if she knows how that injury occurred. It is important to recognize that many reported cases of sexual assault have no physical signs of injury. Nurse will collect and preserve legal evidence such as blood, hair samples, oral swabs, nail swabs, scrapings, anal, genital, or penile swabs. Most of the facilities will have standardized sexual assault evidence collection kits. Use this, and the nurses who have specialized training in evidence collection or preservation could use these kits to preserve evidence. Take gynecological history, including the date of last menstrual period, likelihood of current pregnancy. Assess for a history of sexually transmitted infection. A detailed genital examination with a speculum is needed to observe for signs of injury for a female patient. The nurse plays a crucial role in reducing re-victimization, which refers to the trauma of the examination itself, because the patient may experience it as another violation of her body. So the nurse should explain the examination procedure in a way that it is reassuring and supportive, and perform a self-assessment. Nurse's attitude, understand the myths and the facts surrounding sexual assault. Examine your own personal feelings and reactions before encountering a patient. Be empathetic and provide effective care. Examine your feelings about abortion, because a patient might choose an abortion if a pregnancy results from rape. What are some best practice guidelines for examination? You do head-to-toe physical assessment. Look for signs of injury. Detailed genital examination. Evidence collection and preservation. Documentation of physical findings, both the narrative, written, and photo documentation. Treatment, discharge planning, and follow-up care. Informed consent must be provided and consent forms signed before photographs are taken. According to CDC 2015, prophylactic treatment for sexually transmitted disease is a common practice. Moving on to the nursing diagnosis, rape trauma syndrome applies to the physical and psychological effects of rape. Rape trauma syndrome is defined as a sustained and maladaptive response to a forced, violent sexual penetration against the victim's will and consent. So what are some characteristics of rape trauma syndrome? It includes shame, guilt, helplessness, powerlessness, dependence, low self-esteem, depression, mood swings, aggression, anger, agitation, revenge, substance abuse, suicide attempts, anxiety, fear, disturbed sleep, nightmare, sexual dysfunction, muscle tension, hyperalertness, dissociation, disorganization, shock, confusion, phobias, and paranoia. Other nursing diagnoses could be disturbed personal identity, situational low self-esteem, interrupted family process, sexual identity, sexual dysfunction, anxiety, fear, and social isolation. Your outcome should be absence of any residual symptoms after the trauma, healing of physical injuries, relief of anger. So other nursing interventions include counseling. RAIN, which stands for Rape, Abuse and Incest National Network, they provide chat lines or 24-hour telephone lines that provide direct communication with volunteers trained in rape crisis support. These types of support services focus on helping the person through periods of acute distress. They assess what has happened and determine what kind of assistance is needed. And they refer these patients to emergency department. And the main focus is on the immediate steps the person may take. Secondly, the promotion of self-care activities. Upon discharge after crisis situation, these patients has to be provided referral information and printed follow-up instruction. Printed instructions should include potential physical concerns, emotional reactions, legal matters, victim compensation, and online resources for support groups. Furthermore, case management is required. These patients upon discharge has to be reassessed by telephone or personal contact within 24 to 48 hours of discharge from the hospital. And the referrals should be made for resources or support services. So follow-up visits should occur at least 2, 4, and 6 weeks after initial evaluation. At each visit, the patient would be reassessed for psychological progress, presence of sexually transmitted diseases, and pregnancy. And follow-up examinations are required to check for new infections acquired during or after the assault, for hepatitis B vaccinations if indicated, and to complete counseling and treatment for other STDs, and to monitor side effects and adherence to post-exposure prophylactic medications. And other advanced practice interventions include psychotherapy for survivors and perpetrators. Finally, for evaluation, sexual assault survivors are considered to be recovered if they are relatively free of any signs or symptoms of acute stress disorder and PTSD. The signs of recovery include sleeping well, with few instances of episodic nightmares, eating as they did before the rape, being calm and relaxed, and only mildly suspicious, fearful, or restless, getting support from family and friends, generally positive self-regard about themselves, absence or only mild instances of somatic reactions, and returning to pre-rape sexual functioning and interest. So by virtue of the legal definition of relationship, rape cannot occur within a marriage. False. Flashbacks, frightening thoughts, recurrent memories, or dreams are associated with which category of symptoms in PTSD? Is it intrusive symptom? Is it dissociative symptoms? Is it avoidance symptoms? Or is it arousal symptoms? So those are intrusive symptoms, okay? Frightening thoughts, recurrent memories, and dreams and flashbacks are intrusive symptoms. So PTSD has all these 4 types of symptoms: intrusive, dissociative, avoidance, and arousal symptoms. The intrusive symptoms include flashbacks, frightening thoughts, recurrent memories, and dreams. The dissociative symptoms may include your dissociative amnesia, dissociative fugue, and such. Avoidance symptoms may include completely avoiding certain cues or traumatic events. Arousal symptoms include heightened startled reaction, hypervigilance, difficulty in focusing and concentration, or unprovoked irritability and temper tantrums. So in this particular question, these are intrusive symptoms. All right, thank you so much. And if you have any questions, please email me and I'll be happy to help you.